Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. November is National Family Caregivers Month. It's a time for recognizing the people in our community who provide round-the-clock care at home for loved ones who need help doing daily activities. This caring work is usually unpaid and can go unrecognized. In this episode, we're shedding some light on this important labor of love. Join us for episode 4 of Hands on Health as I chat with Abbie Johnson, a registered nurse with Lower Columbia Hospice. Hi, Abbie. Welcome.
Oh, hi. Thank you for having me.
Well, it's good to have you. Would you tell us a bit about yourself?
Yes, I work with Lower Columbia Hospice. We're an affiliate of Columbia Memorial. We actually are different though because we go out and we see patients in their homes. I've been with hospice for just over a year now. And I graduated from Linfield a few years before that. So hospice has really become my passion. I enjoy it because we're out in the community. We meet all sorts of people. And it's very humbling to be able to help people through this journey and this process.
We're glad to have you. And just to clarify, you are a hospice nurse?
Yes, I am one of our case managers. So I go out and I see patients throughout the week, and I follow them throughout their whole journey with us. And so it allows us to develop a really nice rapport with both the patients and their caregivers.
Okay. And I think we probably should define what hospice care is and how it might be different from other home care.
Yes, so hospice is end of life care. We step in when physicians certify a patient to have 6 months or less to live. And so we help them through that final time and just a lot of symptom management, such as, pain, anxiety, any sort of spiritual issues. We have a great team that can step in and help with all of those things. So,
Okay, so you have a rather unique perspective in medicine because not only are you, it's really about comfort, right?
mhm.
At end of life, you're not saving people's lives, you're helping them to live a better life at the end.
Exactly. At this point, we look at quality of life. If
Mhm.
someone, if all they want, is to be able to go for a walk with their husband or wife every afternoon, we look at things like, okay, how can we get their pain under control so that they can do that? They're not
Mhm.
able to walk as well. Can we get a wheelchair? Things like that, just so that they can enjoy those final moments with friends and family as best as they can.
We're chatting today because November is National Family Caregivers Month.
Mhm.
What does being a family caregiver mean, and how many people are we talking about?
So when I was looking into it, there's actually 78 million people who dedicate their time to be either a paid or unpaid caregiver. And
Wow.
one of the biggest misconceptions with hospice is people think that we will provide the full time hands on care. And we actually rely on families or, assisted living facilities to provide that care. So we rely heavily on caregivers to carry out kind of the day to day things that hospice patients need.
So that's a huge burden on whether it's a spouse or it's a parent for a child who's dying, or it's a friend or a sister or a brother. That's a huge burden.
It is. I think for most people, it's taking care of their parents, and
Mhm.
parents provided similar care when they were babies and toddlers and such. And so they get this opportunity to be able to care for their parents in a much different capacity, but a lot of the same kind of things. And it really allows families to become closer in these final moments that are so important.
Well, will you talk us through a few sort of challenges that families might face? I've got a list of questions here, and I want to see if you can help me and our listeners understand the scope of what they're dealing with. And one that I notice, uh, maybe pre-COVID times, was a lot of people are on oxygen, and
Mhm.
I have a loved one who has COPD, and that's always back of the mind that at some point he might need oxygen. How does that work? And what precautions do families need to take?
Yeah, so if patients are having, shortness of breath or difficulty breathing, with conditions such as, COPD or lung cancer, things like that, physicians will actually prescribe oxygen to help the patient be more comfortable. And so, again, hospice patients are at home. So we get an oxygen concentrator or portable oxygen tanks out there so that they have that continuous oxygen supply. And so, again, it's a huge, huge safety risk. Um, People need to remember to not smoke anywhere in a home with oxygen, um, and to have like a smoke detector and fire extinguishers, just because it is a very flammable product. And so making sure that we have those safety precautions in place so that we can keep both the patients and their family members as safe as we can.
Mhm. So it might take some changing of habits of other people in the house.
Right. Because with oxygen, you need to keep it at least 6 feet away from open flames or heat sources. So it can be, adapting people who are used to cooking and things like that. If they're on oxygen, that's a whole different ball game. So
I never thought of that. That's
yeah, it's one of those it's you kind of
yeah.
learn as you go.
Well, and in our area, especially with these older homes, not everybody has central heat, and they might have, we've got an electric radiator in parts of our house, so I would think that's something that you have to look at as well.
Right. Just always, oxygen tubing, making sure that, you're following the line of the tubing and making sure that it's not caught up on anything like a radiator or things like that as well.
Mhm. Well, so you were talking about how it's in many cases, it's a child caring for an aging parent at the end of
Mhm.
life, and it's this sort of cycle back to, in some ways, the bodily care of being an infant or of
Right.
caring for an infant. And I've got 3 kids, the whole keeping them fed thing was a big deal, and I imagine that is such a different thing with, feeding an adult. What are things that you have to be careful of and pay attention to?
One of the things that, as our loved ones are getting closer to end of life is a lot of our basic functions kind of start to decline. So things like swallowing can become much more difficult. And so making sure if you're giving your loved one a drink of water or, a bite of soup or applesauce, something like that, just like with a baby, making sure that you position them upright so that they're able to swallow without anything interfering. And especially with medications, we can end up giving older people quite a few medications. And so making sure that they're swallowing those pills safely, looking for things like, gurgling, or if their eyes are watering, or if they're coughing after you give them something, can be a sign of aspiration, which means that they didn't swallow the way that they needed to. And so that's a pretty big safety risk as well.
Okay. Well, and you mentioned repositioning. Um,
Mhm.
how do you move somebody around who's, if they're pretty much like dead weight? How do you get them in position? Is it important?
It's hugely important. If our loved ones are getting really close to end of life, things are starting to shut down. And so, skin integrity, as nurses call it, is a huge thing. Our skin is our number one protection against infection. It's our biggest barrier. And so, making sure that we can keep that skin intact as much as possible is hugely important. So, if we have a patient that is what we call bedbound, no longer able to leave their bed and may not even be able to make the smallest position changes that a lot of us take for granted, we teach caregivers to reposition. Pillows become our best friends. We tell families that patients really need to be repositioned at least every 2 hours. And so we kind of develop a system of, okay, let's put pillows, under one side of their body so that they're kind of, tilted onto another side, take that pressure off of those areas like our bottom and our heels, places like that that can really develop skin breakdown pretty quickly.
And by skin breakdown, bed sores, is that what we're
Bed
talking about?
sores, yep,
Okay.
exactly.
Well, I know if I end up, I wake up in the morning and I've been laying on one side all night, I am not as resilient as I used to be, and I'm not I am not, I'm not elderly. I still have enough fat pads in those key areas, but I get pretty sore, so I can imagine
Yeah.
laying all day.
And if someone is really close to end of life, they're not always able to tell us, hey, this part of my body hurts, and so just looking for that redness that can happen if we lay on one side for too long is hugely important.
You have to pay attention to those subtle signals, don't you?
Yes, exactly. You really do.
So, you were saying that they're not always able to tell us, when something's
Mhm.
going on. When I've had, grandparents pass, they tend to go through changes. They often when they die, they are not the person that I grew up with, they're not the person
Mhm.
that, my parents know. I I've seen some people really struggle with that, with those changes in personality and behavior. Do you have is that common? And
That's very
what would you
common.
tell them?
Unfortunately, people can really kind of become confused and disoriented. Their behavior can be a lot different from what we're used to. Some people's prim and proper grandma, now all of a sudden you're having difficulty keeping her shirt on when there's company in the house. And we just really remind caregivers to, respect a person's dignity as much as possible. Even though grandma doesn't want to keep her shirt on anymore, we really should help her to do so and to just practice incredible amounts of patience, because even though that's not the personality that we're used to anymore, we have to roll with it and just sometimes smile and take a deep breath and just go with it. If someone's confused and disoriented, a lot of times it's just kind of easier to play into what they're seeing and what they're feeling so that they don't get upset.
Mhm.
Mhm.
One thing that I noticed with, my grandmother was that at the end of her life, the people who were able to love her where she was were her hospice caregivers because they had no expectations about who she ought to be or how she ought to behave. And
Mhm.
I think that's, certainly one benefit, to having folks
Yeah.
from hospice.
Yeah, one of the things that I always try to remember and to teach, my patients' families is that the disease, not the person, is the reason that these changes are happening. And so, just maintaining that dignity and respect as much as we can is really
Mhm.
important.
If you had one piece of advice to give families who are caring for someone at home, what would it be?
I would say give yourself some grace. We have a lot of family members who are so incredibly hard on themselves as they go through this process, that they end up kicking themselves if they forget to reposition grandma or, to sit her upright when she's taken a pill. And a lot of people forget, I went to school for 4 years to learn how to do this, and a lot of times these family members are getting a crash course in a matter of days or weeks in how to kind of be this pseudo nurse almost to a certain extent. And so, ask as many questions as you can. No question is ever a stupid question, and we're happy to review things over and over if we need to, because a lot of times caregivers are operating with very little sleep. It's an incredibly hard time to be caring for someone who's passing away. And so we understand that we may need to talk about the same thing 3, 4, or 5 different times. And just remember to take care of yourself too. Not only does hospice have that 24/7 nursing support, but we also have a social worker and a chaplain who are available to talk through these different challenges and feelings that everybody's having and to kind of help cope with those emotions. And, our social worker still supports families even after the patient has passed away, just to kind of help everybody cope with this very difficult time.
Well, thank you. I really appreciate you joining me today and
Of
sharing your
course.
insight.
Yeah, no, I love to talk about hospice anytime I can. It's a real passion of mine, as I've said. And so getting to bring awareness to both hospice and the caregivers that power us is very fulfilling. So thank you so much for having me.
Well, thank you. Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health brought to you by Columbia Memorial Hospital.